All right. Jen, I'm going to turn it over to you as we prepare for our Facebook Live event today. Welcome everyone who's joining us on Facebook Live. Um, Jen, do you want to get us started?
I sure do. Well, welcome everybody. I'm so glad that you're all here for this release of our hospitality worker survey. It's been a very long process, so much fun. We've learned a lot. We've heard from a lot of people. Today, we're going to hear from Amina Batata with UNC Asheville, UNC Gillings, Master of Public Health program, and just an overview of the survey and the process that we went through. And then Michael Ratliff is going to tell us the key data and findings. And then we're going to hear from two workers from Asheville Food and Beverage United. Elizabeth is going to talk about what we learned from some of our focus group sessions. And then Miranda is going to tell us a little bit about the experiences of service workers related to the issues in our survey. And then Vicky's going to talk to us about some related statewide public policies that we could look into as a result of this survey. And then we're going to hear from Anna Pardo with the NC Justice Center about statewide public policies. I think I said statewide when I talked about Vicky, but that's going to be actually local public policies. And then we'll wrap it up with call to action and questions from the press. And my name is Jen Hampton. I'm the Housing and Wages Organizer with Just Economics and lead organizer with Asheville Food and Beverage United. So with that, I will pass it on over to Amina and get started with the overview of the survey and the process.
Great. Thank you so much, Jen. I'm going to share my screen and ask if someone out there in virtual land can tell me, can you see the slide with the title on it?
Yes.
Okay, thank you. Appreciate it. Yeah, and thanks, Jen. And hi, everyone. I'm Amina Batata, and I'm a faculty member at UNC Asheville and work with the UNC Asheville, UNC Gillings Master of Public Health program. I'm going to present some brief overview, and Michael Ratliff, just a recent grad, 2024 grad of our program, who's been working as a graduate researcher, will present the findings and some selected findings. So the report is called High Stakes, Low Reward, which is a quote from the study. And the study is the next step in a partnership that UNC Asheville and Just Economics has had for several years. And this year, we had the pleasure and privilege of working with the Asheville Food and Beverage United group as well. The purpose of this study was to better understand hospitality workers here in the Asheville and Buncombe area experiences, perceptions related to wages, leave, and scheduling, and their impact on health and well-being. And this research was funded through an award called the Joseph Chip Hughes Worker Training and Education Fund Award. So as Jen mentioned, it's been about a year since we started working on this, actually over a year now, and we decided to utilize two methods, survey, an online survey, and discussion groups. The online survey engaged and trained community researchers, and you'll hear from one of them today. And we included a questionnaire that was relevant to the study purpose, as I described it, in the areas of wages, leave, scheduling, and health and well-being. We created a Spanish version as well, and the community researchers recruited folks to fill out the survey, their peers, between mid-September and early December of last year. We also wanted to go a little deeper and get some more information and learn about the complexities of these dimensions for the hospitality workers through some discussions. And so we conducted two discussion groups in February of this year. So what we gathered was 188 responses, though for any particular question, between about 98 and 153 responses were completed. We did not receive any questionnaires this round in Spanish, The people who filled out the survey were predominantly white and mostly between 18 and 40 years of age. And if you want to read more about who completed the survey, the report that is linked through the blog that was put into the chat has more information toward the end of the report about who filled it out. And so given who filled it out, we expect that this is not a representative sample of people who work in the hospitality industry. That said, the responses that were provided were extremely varied and rich, even among the people who completed this round of our survey. And we also conducted 2 discussion groups, as I mentioned, and across those 2, we had 8 participants, and they had a lot of experience in a variety of roles within the hospitality industry. And their experience ranged from about 11 to 22 years in the industry. And so we want to make sure that we really deeply thank the people who filled out the survey and also participated in these discussions. It really have helped to elucidate a lot of the experiences and I think systemic issues that exist within the industry here. And it's been a privilege for us to work with you all. So I'm going to turn it over to Michael, and Michael's going to share some selected research findings.
Thank you so much, Amina, and thank you, Jen, and thank you everyone for attending. Again, my name is Michael, and I'm excited to delve into what we found to be our most important key findings in the report. So if we go to the first slide, we will begin by looking into Asheville and Buncombe County's hospitality workers' perceptions on the current landscape of their wages. So after the survey wrapped up, we found that over a third of respondents work multiple jobs. Specifically, just over 37% of our respondents work 2 or more jobs, with the remaining majority working just 1 job. We also learned that roughly 60% of respondents earn an interim living wage, which is $3,120 per month before taxes. And on the next slide, we see that out of 147 people that responded to the question, how many hours a week do you work? Just over a third work 40 plus hours a week, while almost 25% of respondents work 20 to 29 hours or fewer a week. This and our previous questions about numbers of jobs would indicate that working just 1 job or working around 40 hours a week is not enough for some of the respondents to make a living wage. So of the respondents that do make a living wage, 54 people spoke to its impact on their health and well-being. Just over 70% of those respondents indicated that making an interim living wage has had a very positive impact. And while we received many qualitative responses about the impacts of making a living wage, we wanted to highlight these quotes about its importance. These 2 respondents, respectively, indicate that making a living wage is giving them the opportunity to maintain housing and health insurance in an area that has seen housing insecurity and in an area that oftentimes does not offer benefits, or in an industry that does not offer benefits like health insurance. We also learned that over 90% of respondents supported increasing North Carolina's minimum wage of $7.25. So now we'll move on from wages towards paid leave, and we found that less than 25% of respondents get paid sick days. Consequently, 85% of respondents also reported having had to have gone into work while they were sick. And then on to the next slide, we pulled some themes from the discussion groups we facilitated regarding paid leave. Here, respondents primarily spoke to their lack of leave, feelings of guilt when they need to call out of work. As previously mentioned, feeling the pressure to go to work while feeling under the weather, perceptions of leave and other benefits being a right, and having to negotiate financially. And next we'll move on to scheduling, where we learned that over a third of respondents get fewer than 4 days of advance notice on their work schedule, with many of them speaking to experiencing the making of sacrifices, mentioning the last minute and retaliatory nature of scheduling or having to ask off, along with challenges that come with picking up or trading shifts and hour fluctuations or lack of accommodations around seasonal changes. So an example would be fewer hours during winter months. And the link to the full report is being made available, but for the time being, please feel free to access the report using the QR code. I thank you all for your time, and I will go ahead and conclude my portion and pass you along to Elizabeth, who will speak to what we learned from the listening sessions.
Thanks, Michael. My name is Elizabeth. I've been in this industry for 14 years, and I'm really grateful to be a part of what we're trying to do here, what we are doing here. From the focus group that I attended, I think the most significant thing that stood out to me that we all talked about was the gratitude that was expressed in the response and comment section of the wages, health, and well-being part of the survey. And although everybody expressed that what they're making is not enough to fulfill all of their needs, meet necessities, and save money, they were still really grateful for the raise in the minimum living wage that was increased to $22 an hour in 2024, opposed to the $17.70 that we had in 22. And everyone expressed that I passed out surveys to, and a lot of people that I worked with and know expressed that making a real living wage would impact their well-being and health in a very positive way. And that was probably the most resounding response that I got from everyone. Yeah. Thank you, guys. I'm going to pass it on over to Miranda now.
Hey y'all, I'm Miranda. I've been in Asheville for 20 years and 17 of it has been within the service industry. So it's something that I'm definitely passionate about, and I love the community that we have. I think I was able to be part of one of the focus groups as well, and also participated in the study. And you know, even in just talking with a lot of people, because I do feel like I have a pulse on the community here, I think the most important thing that I kept hearing and feeling was like, we right now feel like we're just living. There's no thriving. A lot of people are just barely making it. You know, there were several people in the group who had multiple jobs. And the disparities between the jobs, depending on where you worked, from how much you're making to if it's a corporate place, if like scheduling, if you get paid time off. Most people, it's just so different for everyone. And a lot of the times it is not to the benefit of the employee. So I think the biggest thing that we are looking to see change in Asheville is that as the tourism rise and the costs rise, that our pay and our care is also rising with it. You know, I feel like we carry this tourism industry and hospitality industry on our backs, and that there are a lot of employers out there that don't take care of the people. And, you know, I just keep remembering so many people just really, it felt like a therapy session. I think we said that a couple times, where we could actually feel heard and validated, because I don't think that most people understand what hospitality workers go through in our community. So I think that this study has just been really eye-opening, and I hope that the rest of our community and people will be aware of just, you know, the struggles that the people in the workforce in Asheville have at this very moment. So
Thank you, Elizabeth and Miranda. Your insight into the whole process and the findings are really helpful. I agree. I feel like, you know, there was a lot of gratitude in the room about from the people who are making a living wage and how much of an impact that makes on their lives. And there were a couple of people who had paid time off and expressed how life-changing that has been for them in the service industry. So thank you both so much for being here and participating and contributing so much to this process. So with that, we would love to hear from Vicki about related local public policy. And I think I failed to mention this, but we did put it in the chat, both in the Zoom call and on the Facebook Live, that you can read the entire survey at the Just Economics blog post. So check that out in the link in the chats. Take it away, Vicki.
Thank you, Jen. And hello, everyone. I am Vicki Meath. I'm the director of Just Economics. And I'm really grateful for everyone who worked on this report and survey and study, and everyone who participated in it. And I wanted to name that, according to data from a 2023 report, the leisure and hospitality workers make up about 15% of the local workforce. And that's the second highest number of workers by industry. And we know that with a robust tourism in the region, hospitality workers are a vital part of our local economy. As a community, I think that we need to take care of these workers and advocate for positive changes in both local employment practices and public policies. As far as local employment practices at Just Economics, we have the largest voluntary living wage certification program in the country, and many local hospitality employers are living wage certified. In 2024, as Elizabeth mentioned, our living wage rate for Buncombe County is $22.10 an hour. And this really represents what it costs for someone to be able to afford a one-bedroom apartment in this kind of fair market rent region, if they were working full-time 40 hours a week. So we applaud those employers locally who are doing this, and those who have become living wage pledged employers, making a commitment to actively working towards that rate. However, many hospitality industry employers have not made this commitment as of yet. And additionally, I wanted to point out that our living wage rate is based on 40 hours a week. And what we have to understand is that many of the shifts in the hospitality sector are not 8 hours at a time. They're not typical. They might be 4 or 5 hours based on the job. And so getting to 40 hours a week might mean 8, 10 or more shifts a week. Also, beyond living wages, many hospitality workers in our local workforce don't have access to paid sick days and other types of paid leave. I would argue that this is a top industry for considering the public health impacts of not having that type of paid time off. From a very personal perspective, I can say that directly prior to my work at Just Economics, I was working in a local restaurant, waiting tables and bartending, and I myself didn't have access to paid sick days. As a single parent who was struggling to make ends meet, I went to work sick more than once, just like many of the respondents in our survey. And one time it turned out I actually had strep throat. I didn't want to work. I didn't want to expose my customers and my coworkers, but the lack of paid time off meant that I needed to in order to make what I needed to make to pay my bills. Additionally, I wanted to reference local public policy. I think that there's some good news here. I mean, in the past couple of years, we saw Buncombe County responding to local hospitality worker needs in providing discounted parking to kind of alleviate some of their costs, thanks to the great work of Asheville Food and Beverage United. We've also seen both Buncombe County and the city of Asheville lead by example with with paid family leave policies. And both the city of Asheville and Buncombe County, like I said, passed local policies for their workers at the city of Asheville and Buncombe County to offer paid time off for the birth or adoption of a child or to care for a very sick loved one. So this is good news, but we still have a lot of work to do in the local policy arena. We need the city and county to continue to lead by example, or it's currently the local budget season, and we need the city of Asheville and Buncombe County to lead by example by paying their workers a living wage. We also need to see additional supports. We know that, again, the hospitality industry is such a vital part of our local economy. And in order to take care of hospitality workers, we need to do our best to make sure they have adequate transportation and housing that they can afford that is safe and adequate. And so there's a lot of public policy work that we can be doing at a local level to advance the needs of hospitality industry workers and many workers in our community. So again, I wanted to thank everyone for participating in the survey, and I want to turn it over to my colleague, Anna Pardo at the North Carolina Justice Center's Workers' Rights Project, who's going to talk a little bit more about statewide policy implications.
Absolutely. Thanks, Vicki. Just want to first off just commend the team that worked on this report. I think it's beautiful and really does a lot to sort of give some insight into the world of folks who are doing service work. You know, it's a big and important sector. It's also one of the lowest paid sectors in our state, and there is no good reason for that. Service and hospitality workers are the backbone of our economy alongside care workers, and you know, the work that they're doing keeps our local economies functioning and keeps the places that are desirable to visit for tourists, keeps those places desirable. And so thank you for making Asheville wonderful, and let's make sure you get paid and get good benefits. That said, I want to say that there are multiple efforts going on. Some have been going on for more than a decade to improve wages and benefits at the state level. In North Carolina, we convene a table called NC Families Care, where we sit with Just Economics, working on state level policy and occasionally pinch hitting on federal policy that would implement paid sick days and paid family and medical leave. I want to note for the reporters on this call that there has been a paid sick days bill introduced in our state legislature for 16 years now. Every session, there's a bill introduced that goes nowhere. And I would like reporters to start asking why. Especially in the wake of the pandemic, there is absolutely no reason that anyone could plausibly deny the importance of this very straightforward, very basic public policy. Literally saves lives and saves employers dollars and saves employees a lot of hassle and a lot of suffering. And so that's one of the things that we've been working on for a good long while now. We've also been working to introduce bills to implement a paid family and medical leave insurance system. This is a public insurance system that allows private employers, even self-employed folks and gig workers, to participate in an insurance system that means that when one person, everybody pays in a small amount, and then when one person needs to take their leave, they're able to take it without worrying about how they're going to keep the lights on, how they're going to buy groceries, and they can focus on recovering, whether it's childbirth or major illness, or they're caretaking for a dying loved one. This is what dignity looks like. And service workers and many other workers in our state are denied that dignity, and we need to fix that. There have also been multiple efforts to raise the state minimum wage. And we also were at a table, statewide policy table called Raising Wages North Carolina, with Just Economics and many other groups in the state, working to increase the state minimum wage and to phase out the tipped minimum. You know, tipped minimums are a way that a lot of workers, particularly in smaller economies in more rural places, are really kept out of you know, making a decent livable wage. And so that's a problem that addresses, that's a problem that affects different populations among the service sector differently. And so it's just it's an area that needs to be seriously looked at and addressed. There have also been efforts at the federal level on each of these things. I want to note that there have been introduced bills in Congress to raise the federal minimum wage, to implement a federal paid family and medical leave program, and to implement paid sick days federally, as well as fair scheduling. Those things have all been taken up at the federal level, and you know, we need to support those policies the ways that we can from our little corner here in North Carolina. This year also, even though it is a budget session, there have been several proposals introduced, bills that were introduced last week that would account for many of the policy gaps that have been raised by the workers surveyed in this report. There is a Workers' Bill of Rights type bill, an omnibus bill that addresses everything from paid sick days to paid leave to childcare. It also addresses raising the minimum wage. There are multiple bills that address raising the minimum wage this year in the short session. And, you know, our coalitions are going to be figuring out how to support those bills as best we can. I guess the bottom line is there are multiple efforts by good actors in public office to improve conditions for working folks in our state, including service industry workers. And we need those efforts to be lauded and noticed and appreciated. And when they don't go anywhere, we need the media to be asking the tough questions about why that is. And with that, I will close. Thank you.
Thank you so much, Vicki and Anna. There's a lot of public policy that we could advocate for coming out of this. So I just want to close this out with saying that we hope that this survey helps employers understand what practices and employee policies might help their workers. Because if their workers are happy, they provide better service, that only helps the business and keeps this economy going. We want the businesses to thrive because those of us who have been in the service industry for a long time love what we do and we want to keep doing it, but we also want to live in a dignified way, with being able to take care of ourselves, our loved ones, afford our rent and groceries. It just seems like, you know, and an easy thing to ask for in return for our service and our hard work. We also hope that this will better allow the community and public policy creators to understand more what the employees and workers in this industry need. We also hope that the community will come out of this with a deeper understanding of the needs of service workers and what they do and how the system really affects our lives. And the fact that we, like I said, we love what we do and we just want to have a dignified life. And we also want community to understand that it's important to support employers who pay their employees a living wage and who provide benefits such as paid time off, fair scheduling practices, and paid leave. So with that, we can open it up to a few questions from members of the press and from viewers on our Facebook Live. And you guys, if you have any questions, you can just take yourself off of mute or you can type it in the chat.
Hey, yeah, I'm Will Hoffman with the Asheville Citizen Times. I do have a question. Sorry about that, pretty bright. I report about fair market rent and living wage. I recently reported that you guys, updated 2024's living wage estimate to respect the rising housing costs of our region. And some things I've been hearing from artists and service workers is that the fair market rent, the rapid increase in the past 5 years, and inflation at the same time poses a pretty dangerous, like, long-term threat to service workers' viability in the region. And I was wondering, a lot of artists that I've spoken to, they work in the service industry on the side because it's one of the ways that they can make money while they're making art. And I was wondering if you guys heard anything under those lines regarding the respondents to your survey.
Jen, I can take a little bit of that from Just Economics perspective, and then any of the folks that more deeply worked with survey respondents, if you want to answer. But with Just Economics, we absolutely know that our living wage rate is a minimum, a wage floor. And we also know that it's an hourly wage, and many based on 40 hours a week, and many workers are not getting 40 hours a week. So even if you're making an hourly living wage, it's not necessarily always translating into being able to afford your bills. However, we think it is a critical step towards building a more just and sustainable economy. And really, like, indicative of the ground that workers have lost, the rising gap between productivity and wages. This was reported. EPI, for example, has a Economic Policy Institute has a report on the gap between wages and worker productivity that has increased, and we saw a little bit over the last few years, kind of with the pandemic, workers gaining a little bit of ground, but we haven't made up as much ground as we've lost over the last 5 decades of workers really kind of losing wages when compared to inflation and all of that. So we absolutely recognize that, and our living wage rate is based on on fair market rent and the costs of housing. And certainly it's not something that we hope continues to rise, but housing has risen across the country, and housing was in a crisis in Asheville prior to the pandemic, and is a crisis that has been exacerbated by the inflation and the country's housing crisis. So we put out this living wage rate to be an indicator for employers of kind of where to reach. And I would also say that, we have a lot of small businesses that are struggling to compete in the face of large multinational corporations that are, really being able to continue the economic divide, and many of our local small businesses are put at a competitive disadvantage with some of the multinational corporations and some of the wealthiest Americans. And so that was a mouthful. I said I would let anyone who worked on the survey kind of respond to that, but I just wanted to name that where our living wage rate comes from, and that we recognize all of this, and that this report was an indication of, yes, this is a minimum. And we know that this is challenging for many of our small businesses in our community to meet the living wage, and to do that in the face of the competition that they're with corporations that have record profits. But we want to applaud those employers that are doing the right thing. But I'll turn it back over to see if anyone else wants to say anything that came out of the survey as far as that's concerned.
Sure, I can add a little bit. Thanks, Vicki. Yeah, so we get to see the comments that people make, and I've said this before that of most of the surveys I've been involved in, this is probably the one where people said the most about pretty much everything. It was incredible to see how much people shared and wanted to say. And the question about the impact of a living wage on people's health and well-being was really well responded to and robust. And so many people talked about cost of living and affordability. And they talked about it in terms of, one, that living wage helps them to survive when, not making a living wage can be the difference, really, for a lot of them. There were themes that came up in the discussions as well as in the comments about how having enough hours and being able to, to be able to work and earn a living wage and have enough hours. Only then could they afford to have have all of the basic needs met. And so affordability and cost of living, to your question, I think came up again and again, and how unaffordable Asheville is, and how a living wage is just like a start to being able to make it in this city. And so that came through very clearly across both the survey and the discussion groups.
Thanks, Vicki and Amina. I also want to touch on Will's question about artists in the service industry. And also Miranda and Elizabeth, if you want to jump in on this, that's cool too. But I can just say, you know, from the survey focus groups, there were several people there who were musicians, painters. There's so much creativity in the food and beverage, the hospitality industry here. Almost, you know, so many people that you work with in this industry are artists. In fact, that's why we, Asheville Food and Beverage United, started our Asheville Industry Market, because there's so many of us who, you know, are artists and can't do like the weekend crafts shows because we have to work and not miss it on that money. So we did it on a weekday. And I think that just really speaks to how many people there are in this industry who are in it so that they can do a job with flexible hours that allows them to also do their art, which is what they really love. Miranda and Elizabeth, do y'all have anything to add to that question before we take another one?
No, just oh, go.
No, you go ahead. I was going to say y'all covered it well.
I was just going to add that, yeah, I think a lot of service industry workers, part of why we, you know, are drawn to one of the highlights that we have is that we can be flexible and do things that we're passionate about. So yeah, I mean, even in our focus group, there were artists, musicians, all that, but that also is kind of a double-edged sword at times in the service industry, because with that, you don't know how many hours you're going to get. You don't know if the work that you do will be consistent. And sometimes many people had voiced and had experienced retaliatory scheduling. So if you are someone who needs a bunch of time off for other things that you're doing or things that you're passionate about, sometimes you're met with, well, you always need a bunch of time off, so now you're just going to get 10 hours a week. So I think it can be something that draws people in, but also can be used against them. So it's something to think about.
Very well said. Thank you. Anybody else have any questions for the group? Okay. You're welcome, Will. He says thank you for your thorough responses. Okay, well, if nobody else has any questions, then I guess we can call this a wrap.
Yeah, just one more time, I wanted to just thank everyone all of our panelists who have been here and shared your experiences with the survey. Big thanks to Amina and Michael for leading us, and the community researchers and participants for making this survey of it happen and making it available, and all of the members of the press who tuned in today, and everyone who's joined us on Facebook Live. We think that these issues are important, and it's great to have some more attention being brought to these issues as we work to take care of our community and work towards making a better environment for hospitality workers in our region.
Agreed. Thank you all so much.
Thanks, everyone.
Thanks, y'all.
Thank you all.